Welcome back to second part of our week one lecture. Um, Here's some common misconceptions about administration. Let's be honest by why many exercise science students resist thinking of themselves as administrators. It says myth one, I'm not a business person, I'm a health professional or an exercise professional. This creates a false dichotomy. You can be both. In fact, you must be. Health professionals who can't manage programs effectively serve fewer people less effectively. Myth. And second myth, administration is boring. I want to work with people. Administration is working with people, hiring them, training them, creating environments where they thrive, and good administrators serve members by ensuring quality, safety, and sustainability. I'm not good with numbers, budgets, and policies. These are learnable skills, not innate talents. This course will teach you these competencies. Many of you discover you're better at these than you expected. Administration is just paperwork and bureaucracy. Bad administration is bureaucracy. Good administration is system care. It's ensuring that systems support people rather than frustrating them. I want to focus on programming, not managing. Here's the reality. Even if you never hold a formal administrative title, understanding administration makes you a better programmer. You'll design better programs because you understand constraints. You will implement programs more successfully because you understand systems. You'll be more valuable professionally because you understand the full picture. Here's what I've observed throughout my career. Many of the most talented exercise professionals eventually move into administrative roles because they realize that's just where they can have the greatest impact. As a personal trainer, you might transform 20 lives per year. As a facility administrator who creates excellent programs, hires great people, and ensures quality programming, you can ensure the transformation of 2,000 lives per year or more. The leverage is enormous. Let me show you how administrative decisions ripple through an organization. Administration decisions implement comprehensive pre-participation screening. Immediate effects. You identify high-risk individuals before a problem occurs. You document your due diligence for liability protection. You collect baseline data for program design and evaluation. Secondary effects. Members receive more appropriate programming. Staff have information needed to individualize services. You can demonstrate outcomes more effectively. Insurance costs may decrease due to reduced risk. Tertiary, or the third, that's what tertiary means, the third effect. Member satisfaction increases due to personalized service. Retention improves because programs are effective. Word of mouth referrals increase. Revenue grows. You can invest in additional services and staff development. Program quality continues to improve. Community health outcomes improve. One administrative decision, comprehensive screening, creates a domino of positive effects. Conversely, administrative failures create negative domino effects. The decision to skip proper background checks leads to a poor hire, which leads to member complaints, which leads to cancellations, which leads to financial problems, which leads to program cuts, which leads to more dissatisfaction. Negative spirals often starts with administrative shortcuts. Here's something you might that might surprise you. Good administration doesn't constrain innovation, and it enables it. When your administrative systems are solid, you have financial stability to experiment with new programs. You have competent staff who can implement new approaches. You have risk management systems that allow you to try some new things safely. You have evaluation processes that tell you what's working. You have credibility to propose and implement changes. Facilities with poor administration are always in crisis mode, which leaves no capacity for innovation. Facilities with excellent administration have the stability and resources to evolve and improve. Think about the innovative programs you've seen. Technology integrated training, specialized clinical programs, community outreach initiatives. They all require administrative infrastructure to succeed. Someone had to develop the business model and budget, hire and train qualified staff, create policies and procedures, manage equipment and facilities, ensure compliance and safety, market and communicate effectively. Innovation without administration is just wishful thinking. Administration transforms ideals into reality. Let's be blunt about what's at stake when administration fails. Human cost, preventable injuries and death, delayed emergency responses, inadequate care and services, staff burnout and turnover, community health unmet. The financial cost, lawsuits and legal expenses, insurance premium increases or coverage loss of revenue from member dissatisfaction, facility closures, staff recruitment and replacement costs. Professional cost, damaged reputations, lost credibility, regulatory sanctions, professional liability, and career setbacks. And finally, the community costs, loss of services and programs, reduced access to health resources, community health outcomes suffer, and public trust and fitness facilities damaged. Administrative failure isn't abstract. It has real, serious consequences for real people. And here's another sobering part. Most administrative failures are preventable. They result from lack of knowledge and training, shortcuts taken to save time or money, failure to follow established standards, inadequate attention to detail, assumption that it won't happen here. This course exists to ensure that you don't contribute to these preventable failures. You're learning to be competent administrators who protect people, serve communities, and uphold professional standards. As you progress through this course in your career, you'll develop your own administrative philosophy. Here's some of our essential principles. Safety is non-negotiable. Revenue goals, member convenience, staff procedures, these all matter, but they're secondary to safety. If a practice is unsafe, it stops, period. People are the priority. Systems serve people, not the reverse. Administrative systems should make it easier for staff to do excellent work, for members to pursue their goals. Standards provide protection. Following ACSM and other professional standards isn't about compliance for its own sake. Standards represent collective wisdom about what works and what protects people. Documentation demonstrates care. Thorough documentation shows that you took your responsibilities seriously. It's not bureaucracy. It's evidence of professionalism. Prevention beats reaction. It's always better to prevent problems than manage crisis. Invest in prevention. Continuous improvement is required. Excellence isn't a destination, it's a direction. Good administrators are never satisfied with good enough. Integrity is essential. Your character matters. Make ethical decisions even when they're difficult or costly. Your reputation is built over years and can be destroyed in moments. Administration is service. You're not managing for control or power. You're organizing resources and people to serve a mission. Servant leadership should characterize your approach. These principles will guide you when faced with difficult decisions, competing priorities, and unclear expectations or unclear situations. Now let's connect to what you will do in this course. By the end of this semester, you'll be able to think administratively. You'll see organizations systematically. You will anticipate ripple effects. You understand how decisions in one area affect others. Manage risk effectively. You identify hazards, assess their severity, implement controls, and document appropriately. Lead people well. You'll know how to hire, train, develop, and evaluate staff according to professional standards. Design functional facilities. You understand space allocations, equipment selection and placement, and environmental considerations. Create effective systems. You'll develop policies, procedures, and documentation systems that will support quality operations. Ensure compliance. You understand legal and regulatory requirements and how to meet them. Manage finances. You'll be able to develop realistic budgets, monitor financial health, and make sound resource allocation decisions. Demonstrate professional competency. You'll create comprehensive facility operational manual that showcases your administrative capabilities. These aren't just academic skills, they're professional competencies that will make you valuable and effective. The major work of this course is creating a comprehensive facilities operation manual. This isn't busy work. It's your demonstrating that you can think and act as an administrator. By the end of this semester, you'll have a professional document that includes risk management and safety protocols, emergency action plans, screening and assessment procedures, staffing and training programs, facility design and equipment management plans, operating policies and procedures, record keeping systems, financial budgets and planning. This manual will be helpful to you. You can actually use it to open a facility management or manage an existing program. It demonstrates your competency to potential employers. It's a portfolio piece. You'll build it incrementally throughout 3 drafts, receiving feedback. This mirrors how actual administrative work happens. So in this week, you're going to read, hopefully you read the syllabus in the ACSM Appendix A, the textbook. You're going to do an introduction discussion by Friday. You'll have a faith story response due on Friday, and you're going to do the first paper assignment, AI Enhanced Facility Concept. Let me close by with what this course matters to me. why it matters to me. I've seen excellent programs collapse due to poor administration. I've seen preventable injuries occur because systems weren't in place. I've seen talented professionals fail because they lacked administrative competence. I've also seen mediocre facilities become excellent because someone brought administrative skills and vision. Administration matters. It's not glamorous. It's also invisible when done well, but it's the difference between programs that serve people effectively and programs that fail. You're entering a professional that matters deeply. You have opportunities to improve people's health, quality of life, and longevity. But to do that effectively and sustainability, you need administrative competence. That's what this course develops. That's why I'm passionate about teaching it. That's why I expect you to do your best. If you have questions about anything on this week's assignment, please feel free to contact me. I look forward to seeing how you improve over the semester.